October 1, 2013, the Affordable Care Act's centerpiece, Healthcare.gov, goes live. Millions of uninsured Americans are eager to enroll, but within minutes the website buckles. Users see spinning wheels, error messages, and pages that refuse to load. The system is overwhelmed. According to the HHS Office of Inspector General, at its launch and for some time after, users were met with website outages and technical malfunctions. The promise of a seamless digital marketplace collapses into a national embarrassment. This was not a simple traffic surge. It was the visible symptom of a deeper systemic failure, one that had been building for years. The site was supposed to handle tens of thousands of simultaneous users, but it could barely manage a fraction of that. Reports from that day describe users waiting hours for pages to load only to be kicked out. The frustration was palpable, and it was only the beginning. In the months that followed, investigators from the Government Accountability Office and the HHS Office of Inspector General dug into what went wrong. Their findings were damning. The GAO report, GAO 14-694, released in July 2014, concluded that CMS incurred significant cost increases, schedule slips, and delayed system functionality due primarily to changing requirements that were exacerbated by oversight gaps. The OIG case study, spanning 5 years, identified factors that contributed to the website's breakdown at launch. Both reports pointed to the same root causes: unclear requirements, weak contract management, and a governance process that failed to catch problems before it was too late. The GAO also noted that CMS took only limited steps to hold the contractor accountable for performance issues. These official postmortems provided a clear diagnosis of a system that was doomed from the start. One of the core problems was that the requirements for Healthcare.gov were never clearly defined. The Affordable Care Act set ambitious deadlines, but the specifics of how the marketplace should function evolved constantly. According to the GAO, changing requirements drove up costs and delayed functionality. Between September 2011 and February 2014, the cost estimate for building the federal marketplace ballooned from $56 million to $209 million. By early 2014, the total cost of Healthcare.gov was estimated at $840 million. Yet even as spending soared, key capabilities remained unavailable. The system was being built on shifting sand. The GAO report emphasized that these requirement changes were not minor tweaks but fundamental shifts that required reworking large portions of the system. This lack of stability made it nearly impossible for contractors to deliver a working product on time. CMS chose a cost-plus fixed-fee contract for the main contractor, a risky arrangement that gave little incentive to control costs. The GAO report criticized this decision. Late in development, CMS identified major performance issues with the contractor but took only limited steps to hold them accountable. As of June 2014, costs on that contract had increased to over $175 million due to new requirements and enhancements, while key capabilities remained unavailable. The OIG noted that CMS management failures over a 5-year period contributed to the breakdown. Oversight was reactive, not proactive. The GAO recommended that CMS improve contract management and adhere to a structured governance process to avoid similar issues in the future. Without proper oversight, the contractor had little reason to prioritize performance or cost control. Key governance reviews were delayed until just weeks before launch. According to the GAO, CMS launched the site without ensuring it would perform adequately. The OIG found that CMS management failed to enforce structured governance processes. The project lacked clear milestones and accountability. When problems surfaced, there was no mechanism to escalate them effectively. The result was a system that had never been tested under realistic conditions. The launch date was fixed by law, but the system was not ready. Governance became a rubber stamp rather than a safety net. The GAO report specifically noted that key reviews were pushed to the last minute, leaving no time to address any issues that were found. This lack of structured oversight meant that problems were discovered too late to fix. Perhaps the most alarming detail emerged from House Oversight Committee testimony. CMS officials launched Healthcare.gov against the warning of the agency's top cybersecurity official. According to the committee release, the chief information officer evaluated the risk as high. Security testing in August and September 2013 revealed issues with system availability and testing environments. Yet on September 27, CMS Administrator Marilyn Tavenner signed the authority to operate, authorizing launch despite incomplete security testing. A Deloitte contractor later wrote in an email that the politics around this SCA probably need some careful consideration. This email, released by the committee, suggested that political considerations may have influenced the decision to proceed despite the unresolved security concerns. The warning was clear, but it was ignored. Despite the warnings, the decision to launch was made. The Affordable Care Act mandated that exchanges be operational by October 1, 2013. Political pressure to meet that deadline was immense. According to the OIG, CMS management over a 5-year period failed to establish effective oversight. The GAO noted that key governance reviews were delayed to just weeks before launch. In the end, the launch went went forward not because the system was ready, but because the calendar said it was time. The result was a public failure that undermined confidence in the entire healthcare law. The OIG case study highlighted that the decision to launch was made despite known risks, and that CMS did not have a contingency plan in case the system failed. The launch was a gamble that did not pay off. After the disastrous launch, a massive corrective effort began. The OIG reported that after corrective action by CMS and contractors, Healthcare.gov performance improved and facilitated health plan enrollment for millions of consumers. The second open enrollment period from November 2014 to February 2015 went much more smoothly, but the damage was done. The GAO estimated the total cost of Healthcare.gov at $840 million. The failed launch became a cautionary tale for government IT projects. It showed that without clear requirements, strong oversight, and realistic testing, even the most well-intentioned project can fail spectacularly. The corrective actions included bringing in outside experts, rewriting large portions of the code, and implementing better testing procedures. The site eventually worked, but the cost in money and trust was enormous. The GAO report made 5 recommendations for CMS take immediate steps to assess and mitigate rising costs and delays, improve contract management, and adhere to structured governance. The OIG called on CMS to address identified problems and employ lessons learned to avoid future issues. But the fundamental lesson is broader. Large IT projects require stable requirements, realistic schedules, and independent oversight. When any of these are compromised by political pressure or poor management, failure becomes likely. Healthcare.gov was not an anomaly. It was a predictable outcome of systemic flaws. The GAO warned that unless CMS improves contract management and adheres to a structured governance process, significant risks remain that upcoming open enrollment periods could encounter challenges. These lessons apply to any large-scale government IT project. The Healthcare.gov failure is not unique. Government IT projects around the world have suffered similar fates. The same patterns, unclear requirements, weak oversight, and schedule pressure recur again and again. According to the GAO, unless CMS improves contract management and adheres to a structured governance process, significant risks remain that upcoming open enrollment periods could encounter challenges. The lesson is that systems thinking must be applied from the start. A project of this scale cannot be built on hope. It requires discipline, transparency, and a willingness to delay when the system is not ready. The GAO's warning is a reminder that the underlying issues that caused the Healthcare.gov failure have not been fully resolved. Without sustained attention, similar problems could emerge in other government IT initiatives. Healthcare.gov's launch failure was not a technical glitch. It was a systems failure, a breakdown in planning, oversight, and governance. The cost was measured in billions of dollars and millions of frustrated citizens. But the true cost was the erosion of trust in government's ability to deliver. The reports from the GAO and OIG provide a roadmap for avoiding similar failures. The question is whether those lessons will be heeded. In the world of large-scale IT projects, the stakes are high and the margin for error is slim. Healthcare.gov stands as a monument to what happens when oversight fails. It is a reminder that good intentions are not enough. Without rigorous management and accountability, even the most important projects can collapse under their own weight. This documentary was based on the following sources: Government Accountability Office Report GAO 14-694, HHS Office of Inspector General Case Study OEI Duro 6-14-00350, House Oversight Committee Testimony, and news reports from Fierce Healthcare and KFF Health News. For further reading, links are in the description. Thank you for watching.